I thought this research takeaway was helpful because we don't see lingual lesions that often. I mean, I especially don't because I'm not doing dentals now, and so I don't get that like up close and personal look with the tongue of a dog or cat like I used to get all the time. But when we do see one, our first impulse is usually like, this is really bad, and sometimes it is really bad. Sometimes it's not. With cats, I think it tends to be really bad. But I do think that when we discuss lingual lesions, we need to know clinically what the probability is that we're dealing with something neoplastic. We also need to be able to communicate really effectively with clients about them, because a lot of times clients are going to be faced with a decision about like kind of a radical biopsy or doing something that's going to cause their pet more discomfort, at least in the short term. And they need to know what the odds are that it's worth doing that. And also, we need to be able to communicate with empathy about this possibility that it's going to be something that we are going to have a really hard time curing. So that conversation, I think, is just as important as knowing what we're dealing with. So it seems like it's a two-part thing. And so in this research takeaway, we've also put in some information about communication with clients. And I think it's two halves of the puzzle that, when put together, can be really, really effective in dealing with these.